Hello, this is Dr. Patrick Price, the Body Detective. Here we are briefly today to discuss a few things. Hormones, the mystery area of hormones. Hormones can be quite simple, they can be quite scary for some people. I just got off the phone with a good friend of mine from Louisiana, and there seems to be still some mystery with hormones for a lot of people. I'm going to make it really brief here. Let's start with the brain, the hypothalamus gland. You have behind the eyes, you have the pituitary gland, which is the anterior in the front, and then the back is the posterior. And then behind that, there's a little spark plug looking part of the brain called the hypothalamus gland. Now, the hypothalamus gland is basically the area what we call the master gland. It regulates your metabolism. It also helps to synthesize and secrete different hormones as well, especially your neurohormones. But let me tell you like this, a little differently. Your hypothalamus gland is where you sense what is good for you and what is bad for you. So it's like a survival gland. This is good for me, so I'm going to produce happy hormones. This is bad for me, I've had negative experiences, I'm going to produce hormones for that experience. So remember, it's constantly testing the environment, seeing what is good and bad for you based upon your beliefs and your experiences in your past. So the hypothalamus is basically the lieutenant, it's in charge. So when you go down to the pituitary gland, there's the anterior and there's the posterior. The anterior is where you get your adrenal gland function, you get growth hormone, thyroid hormones, secretions from these areas. So pituitary is a very important regulator also in secreting of the hormones. So you have to start here, looking at the hypothalamus and the pituitary gland. And one simple way that we've treated for years successfully is using glandulars. Glandulars are the vitamins and minerals and herbs involved, but mostly glandulars help feed the actual gland. There's been a lot of controversy over the years for this, but let me tell you, from my point of view, if you're listening to me right now, it works. So research can show what it wants to show you. Research is shown to say it works. Some says it don't. Who paid for that research? What pharmaceutical agency paid to say it doesn't work? Well, they're going to pay that their drug that's very toxic for you says it works wonderful, even all the side effects are there. Remember, research can be kind of grayish. You have to find out for yourself. And so with the pituitary gland, what comes next? Your thyroid. Thyroid is a regulator of your hot and cold, whether you gain weight, lose weight. Hyperthyroid, hypothyroid. And then from there you look at your pancreas. Your pancreas works real efficiently at times, and then it doesn't. A lot of people over 40 start getting diabetes type things where your pancreas just isn't functioning well, it's tired, it's exhausted. And then working with the hormones there, and those produce enzymes that break down your proteins for digesting meat especially. So if you're not digesting proteins, your pancreas probably isn't working properly. The adrenal glands, so you got your thyroid, your pancreas, and your adrenals. The adrenals are your fight or flight. That's the survival ones. We could go on and on, talk all day about those. When it comes down to it, looking from the glands in the head to the glands in the body, is yeast and candida will stop conversions. They'll stop the dopamine levels from converting to norepinephrine in the adrenals. It'll stop the conversion. So you'll constantly be in adrenal fatigue. You'll constantly have your mood down in the mornings and not feel well. So remember, hormones can first, before you go to prescription drugs, bioidenticals, first try your glandulars and find you someone who knows how to test your body, not just by your body weight, but by your body's chemistry, because your body will react differently based upon what time you're even born, what month you're born in. Some people are very sensitive, just the time that they're born, like Libras, people born during that time, very sensitive. Where do you get someone who's a Sagittarius and Virgos? You can poison these people and they just get a runny nose. Their livers are very strong. So there's a lot of factors involved here, guys. Take it from me, find out for yourself, stop listening to everybody else. Stop listening to the research that's telling you this don't work, that don't work. Find out for yourself, and then you'll know the truth. This is Dr. Price, the Body Detective. You take care.